An AIDS activist organization, the Treatment Action Campaign, or TAC, has strongly opposed imminent plans to shut down UNAIDS as announced by the United Nations Secretary General Antonio Guterres. The organization says actively dismantling the only dedicated UN body coordinating the HIV response will have a devastating impact on the lives of millions of people living with and affected by HIV and AIDS, and will, of course, undermine years of hard-fought gains in the HIV response. Now, to discuss this further, we have on the line Ndivuwo Ritshidze, Project Coordinator for TAC. Ndivuwo, very good afternoon to you, and thank you so much for coming to Channel Africa.
Oh, thank you, Innocent. Thank you for having us.
Yeah, I mean, this story has been making headlines for quite some time now, and let me begin by asking you, what impact will the imminent shutdown of this program have on the fight against HIV and AIDS?
So, Innocent, essentially, closing down UNAIDS would mean that we are backsetting as years and undermining the HIV response and all the work that has been put into the HIV responses now. We've had certain victories in certain instances, but at the same time, we have struggled to still keep people on treatment. So closing UNAIDS now would undermine the decades of progress and weaken the global coordination of HIV response at a critical stage of the HIV response in its essence.
Yeah, you spoke about some victories. Are you able to share some of the victories that we're able to achieve, in light of this program?
I mean, this year specifically, we can indicate that there would be celebrations of how we've had 20 years of people living with HIV being able to access treatment. And this is obviously a victory for the Department of Health. So setting back an organization such as UNAIDS, who's been responsible for the HIV response, in ensuring that there's global strategies to, for example, for now, end AIDS by 2030, would really be a setback. It would leave, countries in a sense of a limbo or not knowing how to move forward in terms of coordinating the HIV response at a global level.
Now, Ndivuwo, let's then talk about, the disruptions. How much disruptions has there been in HIV services in South Africa, particularly following the PEPFAR cuts? Are you able to share with us how much disruption?
So, as Ritshidze, which is the world's largest community-led monitoring system that is run by the TAC, where we have been monitoring over 400 facilities over the past 5 years to be able to, look at and monitor the quality of HIV and TB services for people living with HIV in South Africa. And in most instances, those facilities had always been PEPFAR supported. So yes, our national government played an incredible role in facilities, but there would also be that extra aid coming from PEPFAR.
Yeah.
So of those facilities, in our last round of monitoring, we've actually found that there was a reduction in viral load testing, as well as explaining what a viral load test means to a person who's living with HIV. We've also found that there's many reports now of unfriendliness in the clinic, likely which has increased because staff members are also pressured because of fewer staff in place, especially with PEPFAR staff either working at a reduced capacity or just being removed altogether.
Yeah, it looks like the disruptions goes deeper. In fact, my next question was going to be about the challenge of how much the challenges did to the cut on the funding brings. But then let's talk about the interventions that are there to ensure that the fight against HIV and AIDS continues. Do you think that South Africa has the capacity to basically carry that? And for how long? Is it a short term or long term? What needs to happen?
So, Innocent, for now, we're not really sure. If UNAIDS is sunset, we're not sure which body is going to be responsible for the global strategy and so on. So it's really up to civil society organizations in South Africa as well as globally to make sure that it doesn't happen, so that we can still push towards the goal of ending AIDS by 2030. Again, it is up to us as civil society organizations, it's up to us working together with the National Department of Health to ensure that we fix certain things in our facilities, to ensure that it's a warm and welcoming place for people living with HIV. We know that we've got a campaign going now where we want to bring back 1.1 million people back to care, and it's up to us as a collective working together with the department to ensure that that becomes a reality and we actually push towards ending AIDS by 2030.
Yeah, maybe as a parting shot, you have called on the UN Secretary General to save the UNAIDS, and what kind of mechanism are you going to use to basically get the message across? Are you going to use the government? Already I know that civil society is backing you, but what kind of mechanism are you going to use, and do you think that that mechanism will be effective in making sure that the UNAIDS is basically saved?
So what we are going to do is that we're going to continue to use real-time data for advocacy through our CLM approach, the Ritshidze project. And what we're also going to do is that we're going to work with other CLM projects across the global south so that we can present these results to show how detrimental this can be for people living with HIV, as well as other key and vulnerable populations such as sex workers, people who use drugs, transgender people, gay, bisexual, and other men who have sex with men. We cannot afford to have anyone being left behind at this critical stage of the HIV response.
Is the South African government giving you an ear? Are you getting support from that end?
So as the Treatment Action Campaign, we work closely with the Department of Health. We present the Ritshidze data that we collect with them as alongside the recommendations. And I would say that, yes, that we are getting an ear there, and we are having a good relationship in which we are working together. I think right now is not the time for us to not work together. We're at a critical stage of the HIV response, which needs us to band together in order to fight against AIDS.
Just the last one, how can people get behind the banner of this project in terms of, online when they want to support this movement? How do they get in touch with you?
So we do have branches. We have over 300 branches across 8 provinces in the country. We are on Twitter. We are on Facebook. If you are to search Treatment Action Campaign and just inbox us there if you would like to join. You can also get further details on our website, treatmentactioncampaign.org.za. And there's always someone ready available to take a call and to guide you on how to become a member of the Treatment Action Campaign and support in the Ritshidze program where we do this facility monitoring at facility levels.
Ndivuwo Ritshidze. All right, there you have it. That conversation brings us to exactly 12:30 Central African time. Indeed, it's encouraging to know that there is commitment from government in giving them an ear, because this indeed comes with a lot of disruptions. But of course, we believe that they will make sure that this gets into the UN Secretary General's ears to make sure that they save this program. Is quite indeed pertinent that it's saved.